Well, there are a lot of misconceptions about weight loss surgery. So in order to clear up those myths, we brought in our expert from Georgetown Bariatrics and Advanced Surgical Services, of course, Dr. Eric Smith. How are you, my friend? Good to see you.
Thanks for
having me. Looks like you just stepped out of the surgery room.
Well, I'm heading that way.
All right, so what we wanted to understand first, today we're going to do things a little bit differently. We're going to do truth or false and the actual answers. But first of all, we wanted to start with, what are the most common misconceptions about weight loss surgery to begin with?
Oh, wow. Well, there's a lot. And I'm sure we'll probably hit on some of those this morning. But, you know, a lot of people look at weight loss surgery as that it doesn't last. A lot of people look at weight loss surgery that it's dangerous, it's too dangerous. They look at weight loss surgery that it's a cop-out or it's a easy way to lose weight for people as opposed to doing it, quote, the old-fashioned way.
I was going to say the old-fashioned way,
Right.
because they're the stories we hear about.
Sure.
We don't hear about the advancements of weight loss surgery as well, so this is where we're going to get into. Most people who have metabolic and bariatric surgery regain their weight. True or false?
That is false. That is false. And you know, a lot of times people say, well, what's your success rate? Well, really, that's a very vague question. But in general, success is if someone has lost more than 50% of their excess body weight and kept that amount of weight off. Okay. And patients do very well with that. Now, we'll see patients at 2 years lose 75, sometimes 80% of their excess body weight. But the thing that you have to keep in mind is, what are you comparing it to? And we'll get into that in a few minutes, but what are the other modalities for people to lose weight?
Okay.
So they are very successful.
Surgery is a cop-out to lose and maintain weight. Individuals affected by severe obesity just need to go on a diet and exercise program.
Okay, and that is obviously false. It's not a cop-out, and this really kind of builds off of what we just talked about. So here's a really interesting fact. If you take someone who's morbidly obese and you put them on diet and exercise alone, it doesn't matter if they go on The Biggest Loser, Jenny Craig, any program, Private Chef, any nutritionist, and they're morbidly obese, the percentage of patients that lose enough weight to get out of the obese category for more than a year, keep it off for more than a year, is 1%.
Really?
1%. So now we're not talking about somebody who's trying to lose 20, 30 pounds, but someone who's going to go from morbidly obese and after a year they've kept all that weight off
100 plus
and kept it off for more than a year, the success rate of that is 1%. Wow. So when you're talking about surgery and you're getting results of 55, 60, 65%, I think it's very clear what's reality as far as a cop-out and what's an effective modality to treat a disease, which is what this is.
Yeah, I got you now. Bariatric surgery is cosmetic, so it's not covered by insurance. We get asked that a lot.
Sure, and that is incorrect. That is false. The majority of insurances do cover weight loss surgery, including most government insurances as well. Some insurances may choose not to, but the majority do. It is not seen as cosmetic. It's seen to them as cost-saving.
Totally.
Because it gets them off their medications and reverses many of the medical problems that they spend a lot of money on their patients for.
Okay. Bariatric surgery is risky, dangerous, and has a long recovery time.
And that is false. Any surgery has risks. We go over those risks with patients.
Of course.
But there was an interesting study done a few years ago where it compared 4 of the most common surgeries done in the United States. Bariatric surgery, hip replacement, colon resection, and the other one was a chest surgery. And of all 4 of those surgeries, the one surgery that had the lowest morbidity and mortality, lowest risk of death or complication, was actually weight loss surgery.
Okay, I have never heard of this one. You can't get pregnant if you have weight loss surgery.
And that's incorrect. You can, but we do educate patients to try to avoid pregnancy for at least the first year, preferably the first 2 years.
Interesting. Why do you say that?
Well, because we're focused on the mom's nutrition. You know, we're really trying to, even though we're trying to lose weight, we're trying to maximize nutrition. And we don't want mom to be having to share that nutrition with a baby. It can also halt the weight loss. You know, those first 2 years is really the ideal time period where you're going to maximize your weight loss. So we try to prevent them or suggest not to do that during those first 2 years. But many women who think they can't get pregnant ultimately are able to, because some of the medical problems that were keeping them from getting pregnant are reversed with weight loss.
I was just about to say that when you lose that amount of weight. It's something interesting you've said a few times here now. You've said 2 years. Is this a process that you really should look at? This is not a year. This is a 2-year goal for you to be at maximum?
Well, You know, it's a lifelong change, obviously.
Yes, of course.
But we look at 2-year data for weight loss surgery because that is the most accurate and consistent way to follow success.
Right.
When you get 3 years, 4 years, 10 years out, the data's going to scatter a little bit. And it's because some patients are going to stop being compliant. Some patients may stop coming back to their surgeon. The tool is always there. They can continue to keep the weight off. But the data is much more accurate during that first 2-year period.
Well, as always, you're brilliant. We love you coming in. Thank you for
Thanks
giving
for
us
having
all
me.
the information. If you want to find out more information about Georgetown Bariatrics and Advanced Surgical Services, there it all is, everyone. Start your new life today. Make that phone call. They're always available. Back after this short break, everyone. You're watching Midday Kentucky.